especially at this moment, the Victorian public. Their diligence on mask wearing, their focus on distancing, the difficult actions of staying at home other than for the 4 reasons, all of these things are helping Victoria to embark upon and then ultimately to achieve the goal of flattening that curve. There's more work to be done, but there is progress that is being made, real progress, life-saving progress. And today I would like to take you through the situation, the response with regards to the ADF and further actions and announcements in particular, as well as PPE as part of our aged care response. Firstly, in terms of the context, the global context remains deeply concerning. Sadly, every week I've had to report that the pace of global cases continues to accelerate. 1 million cases in 4 days, 16.4 million cases, 651,000 lives lost, and no doubt the real number is higher. These are confronting real human statistics, and they put in place the context for Australia's great challenge. In 7 out of 8 states, we are doing remarkably well right across Australia. New South Wales has been tracing, finding the cases, testing on a huge scale and controlling that outbreak. Again, today, numbers which we would always want zero community transmission, but they are doing an extraordinary job in tracking down, tracing and making sure that the contacts as well as the cases are isolated. In Victoria, however, we know that the challenge is great, and it's a challenge which risks the nation if it's not controlled. So we thank and support the Victorian government for the actions that they have taken to date. The difficult decision that they have taken today is, however, a necessary decision. I, in particular, want to note that what we've seen now is the country reach over 4 million tests, which are helping us to find positive cases, and that there have been over 62,000 tests a day on average over the course of the last week. In relation to Victoria, I'd like to begin with the context. I think discussing with the Prime Minister today over a number of action-oriented calls, it's very important, I think, for us to set out honestly with the nation and with the state where we are. As I say, 7 out of 8 states and territories are in a very strong position, but it could be any state at any time with a disease that has this reach across the globe, clearly heading towards 20 million cases and beyond. Against that background, it is Victoria now. The origins of this, we know. A hotel quarantine breach with, sadly, catastrophic human outcomes. A major community transmission as a consequence of that, and some of the challenges that we have seen in the contact tracing program. Against that background, we have stepped in to assist with that contact tracing, and real progress is being made. The ADF has played an extraordinary role, but I also want to acknowledge and recognise the work of Victoria's Public Health Unit. As part of that, we also recognise that wherever there is widespread community transmission, and this has been the global example, then there are cases of staff as sentinels, representatives of that community, who sadly asymptomatically, with no ability to know otherwise, for it's not within their knowledge, it's not even in many cases within the capacity of testing, those staff have brought such cases into aged care facilities. The Australian achievement until now has been extraordinary, and that is a testament to our facilities and our individuals. At this moment, there is a challenge, and that challenge means that we have to protect those residents and to make sure that we are in a strong position. Our strengths are that the hospital system has been prepared in advance. Ventilation capability, ICU capability, bed capability are very high. Victoria's decision today, which the Commonwealth does fully support, to make additional bed capacity is a recognition of the level of outbreak within Victoria. It's appropriate and it's one which we fully support to reaffirm that. As part of that, we also have very strong primary care and across the country the aged care system is strong. The biggest challenge is when, due to an infection in a facility, the public health unit determines that a significant number of staff or all staff may need to isolate. When all staff have to isolate with little or no notice, then that means that there are residents that have to be cared for. That is our fundamental task. That's why we have set up, in partnership with Victoria, under the leadership of Joe Buffoni, the Victorian Aged Care Response Centre. It's why we also need to make sure that every patient who is COVID positive that needs and would benefit from hospital care is able to immediately access that hospital care. And I thank the Victorian Government for the points that they have made today, that will be the standard which they adopt. And I think that that's a very important step going forwards. In relation to the specific actions, we now have the ADF in place. Today, the figures that I have from General Fruin, JJ Fruin, 1,463 ADF members in Victoria, a range of responsibilities. They are involved in checkpoint control. They are involved in ensuring that isolation is being maintained. They are involved in testing. Overnight, we have had ADF medics step into one aged care facility to ensure that there was support on site. And in addition, they are very involved in the tracing program. They've been involved in making sure that the public health unit in Victoria has support in terms of logistics to achieve that goal of tracing every case every day. Every case every day is the standard which must be achieved in each state and territory, and I'm pleased that the ADF under Commodore Hill has been able to assist. In addition to that, we have 28 foot teams on the ground following up cases where the public health units have been unable, through no fault of their own, to make contact with either positive cases or contacts of those positive cases. Very important work which the ADF is carrying out. We also have 21 ADF in Colac assisting with the outbreak management and response there. I'll turn from the work of the ADF in particular to our support for aged care. Aged care residents represent approximately 7% of the cases in Victoria which have been diagnosed since the 1st of July. They are, like everywhere, a consequence of a major outbreak, hotel quarantine, major outbreak. The aged care workers, as are the health workers, are sentinels of their community and the community transmission. In this case, what we see is that that means that this is a frail community. And with all of their extraordinary leadership and strength, I want to praise our aged care workers, praise our aged care teams, praise our aged care facilities and the families for their work in supporting this community. Against that background, there are, however, 4 significant steps. One, we have established, under Joe's leadership, the Victorian Aged Care Response Centre, and Joe will take you through their actions, which above all else, though, can be boiled down to 2 things: workforce in and transfer of residents to hospital where they need that additional support. Those are the 2 fundamental responsibilities. Secondly, we will be bringing in an AUSMAT team. I have spoken with Len Nataris, the Director of AUSMAT, and AUSMAT will be coming to Victoria. Len is currently formulating those numbers. We will provide those details once they have been confirmed. But AUSMAT, which has helped out in other states and territories, will be coming to Victoria. They have assisted with quarantine. They've assisted in Western Australia. They've assisted in activities around the country, and they are the best of the best. They are the SAS of the medical world. Furthermore, we have put out a call for interstate nursing staff. South Australia in particular has taken the lead on that. They are formulating those resources. And then finally, with regards to PPE or personal protective equipment, we will be allocating a further 5 million masks from the National Medical Stockpile for aged care support within Victoria, and this will be triggered immediately. And for the first time, as an additional measure over and above everything which has been done previously, 500,000 reusable face shields will be made available for aged care in Victoria. All of these measures are coming together to provide that additional support for our beautiful older Australians who are one of the reasons that we've taken such difficult measures, but they are so vulnerable, many of them are frail, and this disease particularly preys on the elderly. It's indiscriminate, but in particular it focuses on the elderly. So that's our task and that's our responsibility.